Enjoy the webinar, and I'll now hand over to Paul Davies, Executive Director of Walsall Council.
Okay, thank you, Matt. Good morning, everybody. Thank you so much for joining us this morning. What we set out to do here in Walsall was do something which has not previously been tried in other local authorities, which is actually work out just what it is that we were getting from our reablement services, because I think it's probably fair to say that in many places there is no direct means of gathering evidence for successful outcomes in reablement, and we wanted to see if we could find a method by which we could look at the obvious thing, the inputs, the outputs, and more importantly the outcomes for people. Our intentions were to reduce cost and to increase the independence of people coming through our services. We understood that this required a fairly significant service transformation. We began the eAble pilot in February 11. It's a partnership between PS Health, who provide the software, and Community Gateway on the implementation. So eAble works very straightforwardly. You will see there is a referral process, and within this it's extremely important that we identify, following assessment, the goals that we're setting for the individual person using the service, going through the service. Built into it is an activity tracking arrangement, and at the end of that an exit process, and the exit process comes complete with all of the information around that individual that we're looking to collect. Okay, so how does it work then? How do we drive the change? Well, it is a step-by-step process, giving us a consistent approach. And I have to say, on a kind of personal basis, having looked at this, the package is extremely useful and extremely easy for our staff to use. Because we are looking to put good investment into this and to make it a core part of our business, you might expect that we've done what we would do, which is put an intense focus on data and management information, because really that was one of the key aims that we set out to achieve. eAble, which is a 100% web-based solution, gives us a full online reporting suite, and it enables us to exercise better control over the activities of the teams who are involved. So what have we achieved then? Well, a consistent process for service users and staff, a single pathway for reablement, which is making a big difference to people. We've got an outcomes improvement of over 15%. We're saving about 1,100 hours per week. We've seen a 30% productivity increase. Perhaps we could have achieved this transformation without new software, but how would we have known? The issue is that actually without this piece of software, which has not only given us the information we need to make significant change for best effect within our reablement services, but it's also given us a means by which we can approach this in a single and consistent way. This has been a more valuable tool simply than the idea of management information would suggest. It's actually been an enabler